At least 32% of Ugandans have some level of hypertension and are not in position to access prevention and treatment, a situation that opens the window for cardiovascular diseases. The Uganda Heart Institute, together with the World Heart Federation, are now putting in place measures aimed at reducing levels of hypertension in the country.
Very difficult to manage complications, including heart failure, including stroke, including renal failure and all that. And these are very difficult and very expensive to manage. You've had people on the radio fundraising for kidney transplants and all that. Some of those conditions are due to increased high blood pressure.
Heart experts explain that having poor health lifestyles and bad eating habits cause hypertension, which lead to heart diseases.
Excessive alcohol consumption, which we know is also a big risk factor. We also see other bad habits like use of tobacco, which is a big problem, as well as recreational drug use.
Well, at least once a year would do. But if the doctor says every 6 months, every 3 months, depending on what he has found out, so it be. But we would recommend at least a year to have your blood pressure checked, your weight checked, your blood sugar checked, your blood fat or cholesterol checked, so that you live a healthy life.
Mutungi, however, cautions the Institute to extend these engagements to local communities for effective control of the infections.
You may have a normal weight, you may be exercising, but your blood pressure may be high because of other things like stress, like which has also now increased in Ugandans. If you don't know, then the pressure is there destroying your internal organs without your knowing. By the time you get to know to get symptoms, it is too late. So these are discussions that we should have with the communities.
The Director Policy and Advocacy from the World Heart Federation, Gerald Mutungi, pledged continuous support to the Uganda Heart Institute in the fight against hypertension in the country.
The things that we'd really like to see as an outcome from this is an increase in the availability of medicines and treatments for people living with hypertension, and also support for the healthcare workers who are offering treatment and guidance to those people.
Mary Namkose, UBC News.